Okay, we are live, but for whatever reason, both of them aren't showing up. Try saying something.
All right, let's see what's going on.
Hmm. All right, let's try to get you back in.
Okay.
Sorry there. We are going to try to get Janelle in. Just 1 second. Let's see here. It's trickier than what you think to get two people on the same podcast. Open link. Okay, let's see if this will get us where we need to be. It's got you sideways. Hmm. Let's see here. Ah, but it's got you sideways. Well, let's see if we can figure it out here. Okay.
All right.
Okay. Can you hear me all right?
Yes.
All right. Well, here we are. It is super tight in the studio. This is pretty funny actually. So, anyway, thanks for joining us. This is our New Year's podcast, the Prosthetics and Orthotics podcast. And what I'm excited about, oh man, I'm off the screen here. So let's see if I can get myself in the screen a little bit more. The other thing we could do, you know, what would be interesting
It's
is
being in the same screen.
we could be in the same screen, but let's try that. If that goes dark, does that still? Nope. And I can't do anything about it on my side either. This is the craziest thing. Okay. Let's try it again. We're just going to make it work. And you're going to have to see my arm, or we'll rotate that around just a little bit so you don't see my arm.
There we go.
There we go. Okay. So, welcome to an episode of the Prosthetics and Orthotics podcast. This is not your typical podcast. And so, my sister, Dr. Janell Wright, has joined us, and she has actually moved back to the U.S. She resides in Atlanta, and we'll hear a little bit about her journey. But she has spent much of her life and career outside of the United States. And so that's going to be an interesting thing to dive into. We may actually talk about some of our childhood too. That should be interesting. And then we go from there. We'll probably dive in. Janelle's been to me with me on multiple trips to Guatemala, and so we'll share a little bit about the prosthetic stuff that's going on with Life Enabled, and how that ties in with her profession as well. So, Janelle, welcome to the show.
Thanks.
Or should I say Dr. Wright? I mean, I don't. I think I can say Janelle, right?
Yeah.
Okay.
I'm just curious, like, where I should be looking.
So we can look at each other, but then you can mostly look at the
Okay.
camera. Yep.
Sounds good.
So I'm over here. You can kind of see we've kind of have a makeshift uh, studio, I guess you would say. So if you have any questions for us, let us know, um, and then we'll just kind of go from there. So Janelle,
Let's do it.
take us a little bit on your journey. So you probably have never listened to the Orthotics and Prosthetic podcast before, right?
I have
Oh,
actually.
you have?
I have.
Okay. Well, you do like podcasts.
I do like
Okay.
podcasts.
So before we get into that part, then, what are some podcasts that you really like that you follow?
It's a very good question. Recently, I've gotten into a lot of entrepreneurial podcasts that, quite frankly, I forget the names of them. But I like listening to them because they are talking about innovation and creativity and new ways of doing things, productivity, efficiency. So recently I've gotten into those. I've also downloaded some finance podcasts because I want to get a little bit more financially literate this year. And so those are the ones that I'm listening to.
Okay, very cool. So I would love for our audience to hear a little bit about your journey into public health, where you're at now, but kind of so we have a very diverse audience, and there's a lot of people that may be curious on how to make an impact while they're not necessarily as a leader, let's say it that
Okay.
way, not necessarily as a clinician, so to speak.
Hmm.
So a lot of times we'll have somebody on that's either a technician or some sort of vendor or something that they absolutely make a difference in people's lives, but they're not uh, impacting them like individually one on one. Now, I know you do some of that, but you are have grown very much into a leader role where you empower others. So, take us on your journey, the multiple countries, some of the languages that you've learned, and then go from there.
Sure. I'm trying to think about, I think, where to start. I think it's a really good positioning to think about how do you think about public health versus clinical health, and is it a versus or is it an and or an and? And so I like to think of it as an and, because a lot of the things that you think about as a clinician, you are also thinking about maybe on a even a bigger scale. So when you're definitely thinking about prosthetics, orthotics, you're seeing a lot of people that may have had diabetes or have diabetes, or they have some other issues that have, um, you know, propelled them forward into a situation where they're going to need a prosthetic or an orthotic or whatnot, and you start thinking, well, what does this look like on a bigger scale? What does this look like for the population? So what are some of those things that we can do to mitigate those issues that lead to the things that we're seeing in our clinics? And that is public health. It's thinking about root causes, it's thinking about population, it's thinking about the drivers of some of these things. Is it what we call social determinants of health? And that's kind of a very jargony way of talking about how does poverty, how does education, how does housing, how do all of these things interlink to create some of the factors that lead toward certain health outcomes? And so as you're thinking about this as a clinician, you're also thinking about this on a larger level. And sometimes you might think, oh my goodness, well, what would happen if I actually went into a community and talked to them about diabetes? Would that prevent people from going into some of these, having some of the impacts that has had on their bodies, right? And so just kind of giving you a framework of what is public health, because I went to I went to a comedy show one time and they invited me on stage and they're like, "What do you do?" And I said public health, and it was just like everybody, oh, like nobody knew what that meant. Um, Granted, this was before COVID, so I think a lot of people started to become a little bit more understanding about public health when COVID hit. But public health is a lot bigger than just infectious diseases and combating that. So, anyway, giving you a little bit of a history about, or just like a little bit of a background about what public health is. And so my journey actually started there. I wanted to be a doctor. I wanted to serve patients, and I was working in a rural community. And every single day, I was seeing the exact same thing over and over. I was seeing gastritis, I was seeing diabetes, I was seeing hypertension. And we just, I was an intern, so we were just giving the same medicine every day. And I thought, what would it look like to be able to go into this community and actually teach them about healthy habits, movement, eating well. And my mom looked at me and she said, that is public health. And so I pivoted really quickly, actually, instead of going into medical school or clinical education, and I decided I was going to go into public health. And so maybe I'll stop there, as like that was my entry into public health and why I decided to go into public health.
So that's quite a journey, and it's interesting to hear that. I mean, would you say, and I, probably not many of our listeners actually know that we grew up out of the country. So
Okay.
so that might be something that we touch on a little bit too. Do you feel like the way that we were brought up and our the exposure in the way that we lived has shaped kind of you where you're at professionally?
Absolutely. I think that growing up, we were seeing our father work in healthcare settings because he's an engineer and he was working on the electrical design and the electrical equipment that was in hospitals. And that was what I thought was, serving people, serving the community. And so that's how I got into, you know, let's serve the community by outreach on their health. And I think that's how you kind of got into that as well. Serving underserved populations, vulnerable populations. And so we got that in Ecuador and in Kenya when we were there, and then also on some of the trips that Dad took around the world. And he would come back with stories, right? He came back with stories from Bangladesh, and I think that's where you got interested in prosthetics and what that could look like to serve a community and make people whole by providing them a way of getting a limb that they lost.
Yeah. So, but going back to your side of things, so you that's something that you wanted to get into and make a difference. And really, we're talking about some of the basic essentials of health, really, around the world and how to be healthy. Um, Take us a little bit on your journey, like countries to countries. What did you actually do? And then I think it's really interesting how you embrace the cultures as you've gone. Like you've dove right in, and I think so. I'd love to hear some of those stories too, because it's not just Spanish speaking. We were around Spanish speaking, but you were in many other places that are different cultures than uh, like a South American culture, Central American culture, where thought thoughts are different, news is different, all that. So I'd love to
Yeah.
hear like some point to point with where you've been and then kind of how it's come full circle now at the end.
So I started out doing internships, as I mentioned, and trying to figure out what I was going to do. So I did an internship actually moving back to Ecuador to work with a public health nurse that we knew growing up. And I thought this will be a great opportunity to learn a little bit more about public health. And that's when I was introduced to working with HIV patients and learning that it's a lifelong disease, learning that it is a huge impact on not just the individual, but the community. And so from those internships, I got a master's in public health. You may have heard of it, an MPH. There's a lot more schools that are providing this education right now. It's a 2 year degree. And in the middle of that, I did an internship in China because I thought, I've done Africa, I've done South America, let's go to Asia. And so that was a completely different culture and got to work in Western China and was working with them in their AIDS center and just got to experience a very different side of the HIV epidemic in Asia. From there, I finished up my degree and I applied to a lot of fellowships. And if you are thinking about public health, fellowships are the way to go, or internships just to get your foot in the door. It's just a great way to get exposure in a lot of different ways. So, out of the, I don't know, 30 fellowships that I applied for, I got one and they gave me 24 hours to decide. I was on a vacation with Aunt Becky actually, and they called me and they said, you have 24 hours to decide if you are going to Vietnam for this public health fellowship with the CDC. And I was like, absolutely not. That's crazy. I'm not going there. And I remember dad calling and saying, you are going. And I thought, no, I don't want to go. I want to stay in I want to stay in North Carolina. I want to work for one of the organizations here. And dad was like, no, you need to experience something totally different. You need to go chase your dreams. And that's a pivotal moment, actually, just having that encouragement from family, friends. So I did it, and that was in 2008, and started my journey on working on the PEPFAR program. And PEPFAR stands for the President's Emergency Plan for AIDS Relief. It's the biggest public health endeavor that the United States has provided for one disease across the world. And as of right now, just as a plug for that, 7.8 million people's lives have been impacted by PEPFAR. And so I started in Vietnam and I started working there, and I was there for 4 years. I learned Vietnamese to the degree that I could order, I could travel, I could read some, I could interact with people. And Vietnamese is not an easy language to pronounce, but the grammar is actually fairly, I wouldn't say simple, but easy. And just, just got into that culture a little bit more. And then from there, I went to Kazakhstan, and that is in Central Asia. And if you're wondering where that is, it is literally in Central Asia. If you look, and it's just like right in the middle, it's the ninth largest country in the world. And so I covered the region of Central Asia with Kyrgyzstan, Tajikistan, Uzbekistan, Turkmenistan, and Kazakhstan. And there I learned Russian, and because I just like talking to people. So and it's easier to pronounce the language, but it's actually, the grammar is very, very difficult. But fell in love with that region. It is a wide open, outdoor space, and just loved climbing the mountains and experiencing very cold winters, experiencing very hot summers. But there I got exposure to a very different environment for public health. The social determinants, as I mentioned before, are very different. Their culture is very different. The things that they care about and the way that they live is very different. But they care so deeply about their families. They care so deeply about their health. And so, working on a diplomatic level with them to respond to the HIV epidemic there, which is primarily driven by people who inject drugs, which is a vulnerable group and it's a stigmatized group. So working on that got me a little bit closer to understanding, what is important in public health and how do you address kind of root causes of public health. From there, I went to Ukraine and I worked there for a year, and I worked on health reform. I took a break from HIV, started working on some health reforms and working with the government on primary care and secondary care, and looking at policies. What does it look like to create policies at a national level to promote health, to identify these root causes of health issues that they're facing, and try to, work with the primary care to have better access for these people to come and get treatment. From there, I went to Guatemala, and in Guatemala, I was there for 5 years and just recently returned from Guatemala. I was continuing to work on HIV, but if you can remember, 4 years back, we did have a COVID epidemic, and that's where I was when COVID hit. And because I was covering all of Central America, I was working on the COVID epidemic and providing modeling and epidemiology and advice for the governments there. We did a laboratory, providing laboratory tests, and provided again the epidemiology around the modeling of the epidemics. And it was very interesting to see how globally what was happening with the COVID epidemic, and we were able to model that out and kind of predict what might be in Central America or coming up in Central America. But for the majority of the time that I was there, I was working on HIV and working with the governments in Central America on issues like migration and how does health impact, or how is health impacted during migration? How is health impacted by, you know, um, actually, some of the climate change issues that are happening and whatnot too. So that's been my journey. And after 16 years, I said, I am ready to return to the United States and be closer to my family. So I worked really hard and got a job at headquarters in Atlanta, CDC, and I'm working there now covering 5 countries in Africa as kind of a overall regional associate director there. So now I have a whole new portfolio in Africa and learning Portuguese and French now. So that is going to be a whole new adventure.
So I mean that's quite the tour, and it's a lot of languages. So let's see. Let's you touched so obviously English, Spanish, Russian, Vietnamese, Ukrainian. Is that a
A little bit of Ukrainian, yeah.
Ukrainian? Um, what's in Kazakhstan?
Russian.
Okay, Russian. Yeah.
Yeah, I
But
didn't
don't
learn
they? Wasn't
any.
there an okay?
Yeah,
There's a
I
dialect
didn't.
there. You didn't do
Yeah,
that.
I did not learn Kazakh.
So now it's Portuguese and French.
Now it's Portuguese and French.
Okay, that's a lot of languages. That's cool though. So food wise, uh, really runs the gamut of good food. Where would you say has been the best food that you've experienced?
I love Vietnamese food. Vietnamese food is unbelievable. It's very light. There's a lot of salads. There's a lot of different flavors. Um, and for meat eaters, I'm actually a pescatarian. So for meat eaters, there's a lot of different types of meat there as well. They use the entire animal. So lots of adventures in that. In Central Asia, there's what's called shashlik, which is a barbecue, and people love that. And you know, in Ukraine, they had a conglomeration of a lot of the different foods across the post-Soviet Union. And I will say Georgian food from Georgia, the country of Georgia, not the state, is bar none the best food, I think, in the world.
So not the
Um,
peaches.
right.
Not that one. Not that- okay.
And I
Okay.
will say, when I got to Guatemala, I thought, we're going to have some tacos. It's right next to Mexico. But let me tell you, when that border hits, there are no tacos. There are some, but it's a very different than a Mexican taco, and the spices that they have in Mexico. So, yeah,
Yeah. Well, interestingly enough, I've never had Vietnamese food, so
we're going to have to go get some Vietnamese food.
okay. They have meat there. I'm not a pescatarian.
They definitely have meat
I'm
there.
a
Yeah,
meatitarian.
lots of pork.
Okay. Okay. Cool. Well, very cool. Let's I'd love to hear some of the kind of the highlights of how public health and the programs that you've been involved with have like what you've seen like changed the way people live or give them a better quality of life. And then I'll ask another question after that. I have another question in mind, but I'd like to hear that part first.
So working on HIV is, again, it's a lifelong disease that people need to take a medication for right now every single day, and so but in the United States right now, in some of the Western countries, they have some injectables, which is, every other week or every other month, or, it's not as much as every day. The reason why I'm saying this is What we have strived to do in a lot of the programming that we are doing now is there's really, really good medication for HIV. There's very good prevention, biomedical prevention for HIV as well. And so it's getting access for people in the community or where they live versus coming to the clinics. And so my whole thing is demedicalization of HIV as a chronic disease. And so it destigmatizes it a little bit more, and it provides a better quality of health or a quality of life. Why? Because people aren't going to have to constantly be taking a medication every single day or going to the clinic every single month for the rest of their lives. So I think one of the things that I've seen is as we've worked with ministries of health and government on policies around demedicalization of a very, very highly complicated, what was a very complicated disease, um, is changing people's lives. They're more adherent to the treatment. They're more willing to live their lives, in the communities, because once you have a suppressed viral load, I know that's kind of a technical way of saying it, but once you don't have as like an undetectable amount of the virus in your body, which we can test for, you don't transmit HIV. And so people are much more confident in their lives, and they're able to live a normal, happy life with those medications. And I would say that's probably the biggest thing on a larger scale. Like once people experience that in their lives, they're able to live their lives. Because when you get HIV, it's not only, some people think of it as this death sentence. Essentially, I'm going to die. And that's what it used to be before there was medication. Now, there's not a cure for HIV, but there are these medications that are very, very effective, and have minimal side effects at this point. I think on another level as well, of people that, are impacted by HIV, a lot of people don't find out until much later when they start getting some of the infectious diseases that are associated with a lower immune system, which is what happens when you have advanced um, more advanced in the HIV disease. And so, some people have lived, 5, 7, 8 years with this disease without knowing it. And so one of the things that we've tried to do is get more access to testing for HIV. So then it impacts, people taking more preventative care of their own lives and those around them, and that reduces the impact of HIV in a community.
Yeah, I mean, I like your the way that you say the what is
Medicalization.
demedicalization of the HIV. I mean, it is a complex thing, but there is also a lot of times a stigma that goes along with that, and I think one of the things that I found that when you talk about some of the stories and going and meeting some of the people that have had HIV is, oh, we just lost your camera. Let's see if it'll.
It says recording has stopped back here. Can you do refresh? Back. Back. Mm. Yeah, I definitely think that there's a lot of okay, we're having some technical difficulties and we'll be right back.